So let's talk about the scheduling optimization more specifically and what our platform actually does. What's the goal? The goal really here is, how do I get the right patient at the right time in the right OR slot with minimal effort and maximum productivity? And so to do that, there's a lot of different factors you got to look at and to try to optimize to figure out what is the right way to reschedule a lot of these patients. Is the patient ready? Have they gotten their medical checklist clearance completed? Is clearly one that you need to make sure that you have a handle on. What about the complexity of the case? Let's assume that if you have a revision that is more complicated, you certainly don't want to put those back to back. So having some rules around how you want to scatter these more complex cases throughout your schedule is important. The OR allocation, what type of OR room is it? Can it handle a revision or not for the case that you want to do? Discharge disposition. Does the patient need to stay overnight, depending on the complexity of the case? Certainly in this pandemic world, last thing you want to do is do surgery on somebody and have to send them into a nursing home. And so taking that into consideration is an important one. Urgency of the case. Maybe you have patients that have been waiting for a long time or they're in pain. Maybe you tag them as medium or high priority versus others that are lower priority. So taking that into consideration is also important. And then finally, patient's availability. Maybe they have already done their clearance, but they, on a personal level, need a caregiver to help them. And so maybe they're not available. So really understanding what their needs are. So what our platform basically does is it takes a number of these kinds of inputs, by the way, that we call them business rules, configurable for you, the way you want to prioritize each of these items, and then provides you an algorithm and a recommendation and a real-time communication that provides you, here's the optimal scheduling that needs to be put in place. Here are the patients that should get prioritized based on the constraints that you have and the inputs that you have defined.